So once you've presented to your doctor with a lump in the breast and you've had a roller coaster ride of tests, your surgeon or your treating doctor will then present you with an array of options that you have to choose to decide what you feel is the best way forward amongst the safe treatment options that have been given to you. That can be very daunting for somebody who's just been diagnosed with breast cancer. So remember, take your time, take a deep breath, relax, understand what your doctor is saying to you. Take the time to write down any doubt that you have before you start your treatments so that you understand what is going to be done for you. It is never an emergency situation. If you have been diagnosed with breast cancer, you have the time of 1 week, 2 weeks, even sometimes up to 3 weeks to understand what is going on in your body, to find out whether the tumor has spread anywhere else, to discuss with the doctor what your surgical options are, whether you should be undergoing what is known as a lumpectomy, which is saving the breast, or whether you would rather opt for a complete removal of the breast. In such cases, again, your options of whether you choose to have reconstruction now, delay it for later, or not choose to have reconstruction, all of this needs to be discussed in detail with your treating doctor. So take the time to do it, and once you have cleared all your doubts, you can plan your surgery. The surgery is done under full general anesthetic. Most doctors like to admit the patient on the morning of surgery. If you have to undergo a sentinel lymph node biopsy, you will have the injection of the nuclear medicine either on the morning of surgery or a day prior. After admission, you will be taken to the operating room where, after you've been put to sleep, the surgeon will start the surgical process. For most breast surgeries which do not involve reconstruction, whether it is a lumpectomy or a total breast removal, the surgical time is anywhere between 1.5 to 2 hours. Recovery is fairly quick, and most women within an hour to 2 hours after surgery are able to get out of bed and walk to the toilet, and within 4 hours of surgery they are able to drink, and after 4 hours they are able to eat a light diet as well. However, for older patients, for infirm patients, for patients who have other medical problems, the recovery time may be slightly delayed. Surgical time can be prolonged to anywhere between 6 to 8 hours if you choose to have reconstruction at the time that you're having the primary breast cancer operation. Now, if the total breast has been removed, or you have had surgery where lymph glands from the armpit have been removed, or you've had a reconstruction, then you will certainly have what we call drains hanging out from the skin of the body. These could be attached either near the chest wall if you've just had the mastectomy, or in your abdominal wall or your back if you've had reconstruction where tissue has been taken either from the abdomen or the back. A drain is a pipe to which a bag is attached. It is kept in till it drains the dirty fluid that the body makes as part of a recovery process. Generally, these drains remain anywhere between 1 to 2 weeks. For certain patients, these drains need to be kept for longer. The drain is attached with a little suture or a little thread onto the skin. You do not need to be hospitalized for that long. A lot of patients are able to go home within 1 to 2 days after surgery and are self-caring and normally mobilized. We teach them to put the drain in a sling bag which keeps their hands free and they are able to go about their daily activities. The drain can then be removed in the outpatient. It hardly takes a minute or two and is not a painful process. Sometimes your drain might get pulled out at home inadvertently and you might notice some fluid staining your clothes. Don't panic. If it is within the working hours of the hospital, talk to your doctor and go in. If it happens in the middle of the night, don't panic. Don't rush to the hospital. You can keep a clean piece of gauze or a clean towel over it and then talk to your doctor and come in. In such cases, most of the time, we may need to take the drain out early. Now, if we have to take the drain out early, or in some women who are producing a lot of fluid and the drain is removed after say 2 to 3 weeks, sometimes they may continue to collect that fluid under the skin flap. We call this a seroma. Again, nothing to panic. We can put a little needle in the outpatient and drain the fluid for you. It is a painless process because the area where the surgery has been done is generally numb for a few weeks to sometimes a few months.